This mnemonic is coming to us from John Bielinski, who's a practicing physician assistant. Now, it's RR owl. This is how you can very quickly assess a respiratory patient. So think of a pirate owl, like R, like a pirate, right? So RR owl, that's the mnemonic from John. Now here it is. Helped me a lot. Hope it helps you. RR. So the RR is respiratory rate. So what's the respiratory rate of the patient? O is for oxygen. What is the patient's SpO2? Bonus alert, I got a bonus tip for you, and here it is on pulse oximetry. If you have a patient with COPD or chronic lung disease, you want to ask them and their family, what's the normal SpO2 for them, and titrate your oxygen to that level. 94% might be good for somebody with COPD. So we want to get them back to normal, not blast them up to 99. They're not used to being there, right? Get them back to their normal. Everybody else who's having an emergency, but they're not COPD or chronic lung disease, get them back to 94, 99, as high up as we can, okay? Now, words percent. Words percent is a patient speaking in full sentences, the best outcome, the worst outcome, they can't speak, right? It's somewhere in between, like 1 to 2, 3 word sentences. Labored signs. So, do we see signs of respiratory distress? That's what we're looking for. So, respiratory distress signs would be retractions in between the ribs. Could be accessory muscle use, pulling in the neck, right? Those are two I always think of. Positioning. If someone, let's say, is in a tripod position, right? If I'm bolt upright, if I'm in a tripod position, right? If my head is up, I'm trying to get more of a breath. Look for these positionings as well for signs of respiratory distress, and don't forget the skin too.